Welcome to CRC Health Connect. I'm your host, Dr. Siu Him Chan. Today we have a special guest. Jacky is the pharmacy manager of CRC Pharmacy. Welcome, Jacky.
Thank you, Dr. Chan.
So, Jacky, we've been hearing about this new pharmacist service that started about a couple of months ago called Minor Ailment and Contraceptive Service. Could you tell us more about that?
Of course. The service is called Minor Ailments and Contraceptive, in that we are able to now, pharmacists are able to now treat 21 of these acute but minor conditions. So actually, this service has been adopted by many other provinces already. BC is just the latest in joining the other provinces to provide this service. This service, some examples of what we can treat would be acne, a lot of skin conditions, urinary tract infections, eye infections, even shingles, actually.
Wow. So that certainly covers a lot of ground. And do pharmacists require additional training to be able to provide this service, or was this part of your training to begin with?
This actually is part of our training since the pharmacy school years. We already have most of the conditions covered during our pharmacy years. It's just that now we are able to more fully utilize our kit. On top of that, the government and our college also provided quite a bit of extra resources for us to study on and reference to better provide the service to British Columbians.
So in your community, the pharmacists certainly welcome this change or sort of additional service that they can provide to the public.
Yeah, our team is quite excited to be able to finally utilize a lot of the things we have learned in school, but rarely get to fully use in the community pharmacy setting. And now we are picking it back up and feeling more able to provide more service for our patients.
That's great. So you mentioned that it's been around since June, and what's the reception by the public like?
Quite positive. Most patients enjoy this service, and its use actually is steadily increasing over the last 2 months.
And why do you think there's such an appeal?
A lot of patients, I think, really just appreciate that their problem are able to be looked at more promptly, especially with the doctors being so shorted right now. A lot of patients with small problems, but maybe more urgent nature, just really need them to be attended to. And some conditions like, for example, viral infections and shingles, with a more prompt treatment, better health outcomes can be achieved.
Certainly, yeah, I would totally agree with what you said about the doctor shortage, and sometimes it's not just about the number of doctors, also just the access to service. I think the primary care need is great, and certain specialties as well. And I guess with the conditions that you named off, I think if the patients can get timely care, they would certainly save themselves a trip to the emergency department as well.
Yeah, and doctors are currently pretty, like, even family doctors are pretty hard to book. Walk-ins are virtual or in person are pretty hard to get as well. So this service can, I think, really provide more timely care for a lot of patients. So increased accessibility is never a bad thing.
So Jacky, why don't you walk me through exactly how I can access this sort of consultation service? Let's say I do have an ailment and it's the weekend, like today. My family doctor doesn't work weekends. So how do I get that service from you?
Quite simple. You just bring your care card or service card and present yourself to the pharmacy. Just like if you were to drop off a prescription, go to the counter and tell them that you want to receive this service, and you will have a consultation. So we currently provide walk-ins as well as appointments, and usually we also have a specific, more private kind of room designated for the use for this service as well.
Okay, so is kind of like a doctor's appointment in a way, setting of such at least. And you mentioned a walk-in component. Is there a long wait for this service usually?
Certain times, especially during busy hours, there can definitely be a longer wait. We try our best to accommodate walk-ins, but appointments would really help us manage our own workflow as well. So the appointments are also very simple to access. Just like if you were to book COVID shot appointments, the government has a portal website where you go and input information just like the COVID appointments, and you can get one of the consultations.
Great. So at the end of the consultation, can the patient expect a prescription every time, or how does that work?
Only if we deem that their condition absolutely requires medical treatment, then they may receive the prescription. But again, this really depends on during the assessment that we have to determine that what they think they have is actually within the list of things we can actually treat, and that their condition isn't very severe or isn't likely to be something else. If any kind of red flags or any kind of uncertainty arises during our assessment, usually that would be followed with a referral. We will draft up a referral letter with all the encounter notes and patient notes documented, and either the patient can take that to their physician, or we can fax it to the physician of their choice, and then they can follow up that way with the referral.
I see. So on that note, since I come for a visit about my medical condition, whatever consultation that you give me or opinion and whatnot, I suppose that becomes sort of part of my medical record, right? So how does that work? Do I need to request that to get that sent to my regular family doctor, or how does that work?
There isn't a automatic sending of these notes to the primary care provider per se right now. So the patient or the prescriber usually will request it for it to be sent in order for it to go to them. But if during the assessment we determine that the follow-up needs promptly looked at, or the condition could be severe, then usually we probably will automatically fax it to the primary care provider, just because we think it's pertinent that it gets looked at right away.
Great, to sort of ensure that continuity of care, right?
Yeah.
Great. Okay. Is there anything else that you would like to tell us about this service?
I think we covered most of it. The only thing that comes to mind would be sometimes for some of the conditions, we actually have some limitations in that we can't provide all the available treatments for a certain condition. Just for example, acne, there's oral and topical treatments. Unfortunately, currently we can only do topical treatments, but that's something usually we will let the patient know before we start the consultation, just so everybody's expectation is set.
Great. And I understand that you practice in Richmond, so I understand a lot of Asian patients reside there. So any other additional sort of language or cultural sort of services that you guys would provide to sort of meet that need?
Yeah, we currently have quite a bit of Asian population at CRC where we practice. We provide the service right now in English, Mandarin, and Cantonese, as most of our staff is trilingual.
That's great. So I think it's an amazing service that you guys are doing, and certainly with the primary care in crisis in certain areas of the province side, this would be invaluable. So are there a lot of pharmacies doing this?
There are probably quite a few pharmacies that are joining this program, as this is a professional kind of initiative for our entire profession. I think most pharmacists would be excited to be able to utilize what they have learned fully to provide this kind of service. So as far as I know, quite a bit of pharmacists are jumping on to help out with the current healthcare situation with this service.
That's great. Whatever helps, right? Always takes a village. Great. Thanks again for joining us, Jacky. We hope to see you
Thank
again.
you.
Cheers.
Thank you.
Bye for now.
Bye.